Testing.
Hi, everyone. We're going to get started in just a minute. Hello, everyone. Can I just get a quick sound check? Can you hear me okay?
Yes.
Okay, great. So thank you for joining us for this media briefing about COVID-19 vaccine in Idaho. My name is Zachary Clark, and I am moderating the briefing today. American Sign Language interpretation is available today, or at least will be very soon. Search for the window for interpreter stubs and hover over the three little dots to the right in their window, video window to lock the screen in place. For the briefing today, we'll be hearing from Health and Welfare Director Dave Jeppesen and State Epidemiologist Dr. Christine Hahn before we open it up for vaccine-related questions from media participants. Idaho Immunization Program Manager Sarah Leeds will also participate in the briefing. We will not be taking questions from the public at this time. Please note that everyone should be muted unless they are speaking. And with that, I will turn it over to Director Jeppesen.
Thank you, Zach. Appreciate that. Welcome, everyone, to our weekly COVID-19 vaccine press briefing. This past week, 59,925 first and second doses were administered across the state. That's our highest number of doses administered so far. Last week, we essentially received 2 weeks worth of doses into the state due to the weather delays from the prior week. That means that Idaho did not lose any doses as a result of the weather delays. They are all here in the state now. And our first doses continue to be administered within 7 days. We mentioned this last week, but a quick update on the statewide vaccine registration solution. That solution will go live later this week. The limited supply of vaccine has led to limited appointment availability. This has created a situation where individuals are making many attempts, sometimes daily, to schedule an appointment, which has led to overwhelmed phone lines and websites and resulted in frustration for many. The main objective of this solution is to give Idahoans one place to go to register that they are interested in getting vaccinated. Once registered, an enrolled COVID-19 vaccine provider will reach out to schedule an appointment when they are eligible to get vaccinated and the provider has appointments open. This will eliminate the need to check websites or make phone calls multiple times a day. Idaho is now receiving 40,000 first doses a week, and this will increase with the addition of the Johnson & Johnson vaccine that Dr. Hahn will speak about in just a moment. In addition, 47% of those 65 and older who have now had at least one shot, with between 8% to 11% of this age group getting vaccinated each week. As a result of the increased supply of vaccine, coupled with the current vaccination rate for those 65 and older, I am pleased to announce that Group 2.3 will open up on Monday, March 15th. Since the situation varies from each public health district, a public health district can decide to move to Group 2.3 sooner if their situation warrants it. We estimate that Group 2.3 is around 134,000 people, and as a reminder includes food and agricultural workers, which is food processing workers, including the USDA processing plant inspectors, grocery, convenience store, and food pantry workers, the Idaho National Guard, a subset of essential gas, electric, water, and telecommunications utility workers who work indoors, manufacturing workers, public transit workers, U.S. Postal Service workers, and flight crews. Please note that interpreters and janitorial or cleaning staff should be vaccinated with the sector and setting in which they work. Finally, just a reminder to please stay physically distanced, wear a mask, and keep your hands clean and stay home when you're sick. We're still in this race to get vaccinated before particularly this new variants catch hold here in Idaho, and so we encourage everyone to continue those proven safety practices. And with that, I will hand it over to Dr. Hahn.
Thank you, Director. Can everyone hear me okay?
We can.
Okay, great. Thank you. So briefly, I'm sure you're all aware that Friday, the FDA's Vaccines and Related Biological Products Advisory Committee met, recommended the Johnson & Johnson vaccine. Over the weekend, the FDA authorized this for use in the United States for 18 and older, and Sunday, CDC's Advisory Committee on Immunization Practices met, and again, also it's not just authorized, but the CDC's role is to recommend this for adults 18 age and older. And the director of the CDC, Dr. Walensky, has signed that recommendation, so it is now an official CDC recommendation to be used in adults 18 and older. Yesterday, CDC's advisory committee met again to talk about some of the nuances with this vaccine. Many of you are aware that it's different. The first two vaccines we got were fairly similar. They had some differences, of course, but a lot of the considerations, a lot of logistics are very similar in requiring freezer capacity and requiring 2 doses, et cetera. And so there's a lot of excitement now that we have a 1-dose vaccine. And the handling requirements are much easier because it can be stored in refrigerator type temperatures up to 3 months. We're very happy to have this, and I think this is going to really help. Each dose represents 1 more person fully vaccinated, which is very exciting. We do need more vaccine in the state. Our providers have been telling us they could do more vaccinations if they just had more vaccine, and I think this will help a lot. And hopefully impact the waiting lists that we know are still out there in some of the health districts. This vaccine was found to be very safe in the trials, well tolerated. It's a nice option for people that for some reason or another, such as an allergic reaction or a history of severe allergies to an injection, couldn't receive the mRNA vaccine. It's also a great option for people who really rather just get a one dose shot. People that or that people that have an adverse reaction after their first vaccine of the Pfizer or Moderna. After a 28-day period, if they really are contraindicated to get a second dose of the Pfizer or Moderna vaccines, they can consider getting the Janssen vaccine as an alternate and be fully and have the confidence that they are indeed fully vaccinated. So there are some really great uses of this. In addition, we're really excited about the chance to get this out into smaller, more mobile, maybe mobile clinics. Areas that were challenging logistically because of the needs with the frozen vaccines to do large batches at once of people being vaccinated. So we're really happy about it. We know that there are people that this is another new vaccine. People will have questions. I'm sure you guys will have questions for us, and so we're happy to talk about it more. And we know that we'll continue to work to have all three of these vaccines available for Idahoans, with hopefully Idahoans in some cases being able, if they do have a strong preference, being able to decide for themselves which vaccine to get. We do recommend, like we do for the flu shot every year, that unless there's a specific medical reason to get one or the other, that if you have an opportunity to get a vaccine, we do wholeheartedly recommend all three of the options. Secondly, I just wanted to mention our race and ethnicity data. You know, it's been a journey for us. We weren't really collecting any in the beginning. Now we've got it up and running. We were able to adjust our registry to accept race and ethnicity data on vaccinated persons. That was just posted. I think hopefully you all saw the press release that is now posted on our website, coronavirus.idaho.gov in the vaccine page. And you can look at that data yourself. We're aware that we have a long way to go to improve that data quality. This week, we now have 62% of our records containing race and a little over half of our records retaining information on ethnicity. And that's an improvement over previous, but we do have more improvements to go. As a reminder, the patients are not required to provide that information. So if a patient comes to clinic to get vaccinated and wants to decline reporting their race and ethnicity, they have every right to do so. However, what we want to make sure we're getting is when that information is available, that's always coming to us. Some have noted already that in the data that we posted yesterday, there's a low percentage of folks of Hispanic ethnicity. We think that might be twofold. One is we are very concerned about low vaccination rates potentially occurring in that population due to maybe less healthcare access, maybe communication or language barriers, and knowing where to access vaccine, how to access vaccine. Again, we hope that improves. But also as a reminder, our first groups of vaccinated people were mostly healthcare workers or seniors, and actually in those two populations, our Hispanic representation is lower. So we think that over time, and we start to vaccinate more in a worker population and a younger population, that we will catch up and that will improve. Nonetheless, we will work to improve that, not just passively wait for that to happen. So again, that data is all on the coronavirus.idaho.gov's vaccine data dashboard, so that if you want to go take a look at that. Lastly, I'll mention that our Coronavirus Vaccine Advisory Committee is meeting this Friday. And as always, it's open to the public to listen or watch in a listen-only mode. Again, that link is already posted on coronavirus.idaho.gov. As you can imagine, we'll be discussing continued conversations about the current groups, making sure that we are thoughtful about who is included. The director just mentioned that group 2.3 will be eligible very soon, and we may have some questions or things to clarify with the group on that, but also we're really going to be looking forward to the next group, which we're going to be calling group 3. And looking across the nation, really some states have gone to age-based recommendations where it's really based on age groups. alone. Not many states have done that, though most are including conditions, chronic diseases, along with an age-based consideration. Lastly, of course, there are other essential workers that have not yet been included and are not in 2.3. Folks such as people that work in transportation, people that work in some food service industries, shelter, housing, wastewater workers, etc. So we have a lot of work to do on Friday, and it should be a good discussion. Lastly, I want to mention that actually as part of the CVAC meeting, we will be giving an overview of our plan that we're developing, a plan for equitable distribution of the COVID vaccine. Again, in the beginning, we were so focused on getting it to healthcare workers and to seniors, but as we move into more of the general population and worker population, we need to have a robust plan, operational plan in place. So that will be presented at least at a overview for the committee on Friday. So you'll hear more about it after that. And that is all I had prepared. So happy to take questions.
Okay, we will now take vaccine-related questions from media participants. We will answer as many questions as possible in the time available. Please raise your hand in WebEx by selecting the hand icon in the lower right portion of your screen. You can also type your question into the chat area, which you can access in the lower right part of your screen. When I say your name, please unmute yourself and announce your name and media outlet before asking your question. And please remember to clear your hand. So the first hand that I am seeing is Chase Biefelt.
Thank you, Zach. My question is about, well, it's related to the news coming out of Texas that they kind of lifted all their restrictions for the public. Just asking, is there a time that, or is this even in the foreseeable future for Idahoans to see all restrictions lifted? Just wondering.
Yeah, Chase, that's a very, very difficult question. I will tell you that the director and myself and others from the department had a very robust and thoughtful conversation, I thought, yesterday, the governor and the office about this very issue. And for that purpose, we are going to develop some metrics looking at when are we really going to be ready to do that. How it's different from what we've been using so far is that we need to incorporate the concept of vaccination of the population and just our general level of immunity in the population, which we think will be really important to determine when we can really get back to normal. And I don't know if the director, if you want to add anything more to that, but it is a very important discussion, and we are going to tackle it. I don't think we foresee that as anytime real soon, but we do need to start planning for it.
Okay, next question.
Sorry, I tried to toss it to the director, but maybe he doesn't have anything more to add, which is fine.
Well, Dr. Hahn, actually, I think you covered that well. I think we continue to look at the metrics as we have for the last year, and we're looking at adding an additional metric, which would be vaccination rate, as you mentioned and described so well, and that just will drive as we move forward from here.
Thank you both.
Okay, next up we have Hyatt Normini. Sorry if I mispronounced that.
Hi, thank you. I'm with the Idaho Statesman. I was just wondering if you can provide a little more specifics on the Johnson & Johnson doses, how many Idaho's received when they arrived, where they're getting distributed, and if there's any strategy on who's getting those vaccines versus alternatives, since those other ones require 2 doses and this one is a single dose. I'm wondering if there's any strategy behind it.
Yeah, thank you, Hyatt. I will give you a few thoughts, and then I'm going to turn it over to Sarah Leeds. As you know, we were in a challenging position because the CDC's advisory committee met as late as yesterday. I think if I remember correctly, the call wrapped up around 2 o'clock yesterday. And at the same time, we're ordering vaccines. So it is, we are definitely working on developing more specific strategies, but Sarah can tell you about how many vaccines we've received and where we're sending those this week. Sarah?
Yeah, thanks, Chris. Idaho got 13,300 Janssen doses with our state allocation. And we yesterday, late afternoon, we let all our health districts know how we were allocating to them by region. And so they have until the end of today to let us know where they want those doses to be distributed to. And we place the order, and those will be shipped by Johnson & Johnson tomorrow. We anticipate them in Idaho Thursday. So yeah, with 13,300 doses, we have the most are going to Public Health District 4, and of course they tell us where. They don't go directly to District 4, but the high is 3,700 doses in District 4. To the lowest amount is 1,000 doses going up to Public Health District 2, and so there's a range within there that each Public Health District is going to get.
Thank you. And just a quick follow-up. Dr. Hahn had mentioned that people getting the Moderna and Pfizer, the first dose of the Moderna or Pfizer, can still get the Johnson & Johnson vaccine. I'm wondering why that is. Doesn't that risk wasting a lot of Moderna or Pfizer doses?
Yeah, let me clarify, Hyatt. I kind of threw that in there, and I probably should have slowed down a little bit and explained that. There are some people who get a first dose of one of those other vaccines and get a severe allergic reaction, say. So now they're told you cannot get that second dose that's contraindicated for you. Well, in that case, they're like, well, wait a minute, now I'm not fully vaccinated. Where does that leave me? And for those people or similar situations to that, that is when CDC says, wait 28 days and you can get the Janssen vaccine, single dose, now you're fully vaccinated. So that would be the kind of situation I'm talking about, not an everyday occurrence. Hopefully, we certainly don't want people to say, wow, I got a dose of Moderna, but oh, I see they have Janssen down the street, I'm going to run down there. That it's not designed that way, but for people that really can't get that second dose.
Thank you.
Mm-hmm.
Okay, next we have a question in the chat from Karen Bosick, and she writes, I understand that the 3 vaccines currently available are very good at preventing hospitalization and severe COVID-19. Do we know whether they prevent long hauler symptoms in milder cases?
Yeah, so they do appear to prevent milder cases in the studies. If you look at the study, it's interesting with the Johnson & Johnson vaccine, it actually performs better against severe disease, meaning kind of like our flu shots work sometimes, where they'll keep you out of the hospital, you might still get a mild case, but they all do seem to have good effectiveness against mild disease. Against long haulers, that is just not yet known yet. If you remember, even the, boy, it seems like we've had the Pfizer and Moderna vaccines out there forever, but it was mid-December when we started vaccinating with that. So there really hasn't been enough time to determine how long, what kind of protections it'll give. However, it is likely that if you prevent the disease itself, if you prevent coronavirus, or you prevent, even a mild case, you are probably going to prevent that long haulers. I think it's very analogous to the shingles vaccine, where not only are you protecting the person from shingles, you're protecting them from that long-term nasty nerve pain that people can get after having shingles. So stay tuned. The manufacturers can't claim that they protect against long haulers yet. They need time to show that, but it is expected that it probably will.
Next question is Nicole Camarda.
Hi, this is Nicole Camarda with Idaho News 6. My question is for the director, a little bit more about this pre-registration solution. My understanding is that this is going to be like a website, correct? My audio kind of cut out in the beginning, so I didn't hear the full part of it. But is this planning on being some sort of website that people can go to?
Nicole, this is Director Jeppesen here. Yes, this is a website solution. It's one place that Idahoans can go to pre-register or register that they want to be vaccinated. We'll ask for some basic information such as name and address. We'll ask if they have an underlying health condition and even if they have a preferred provider. Once they're on that list, providers will then reach out, providers in their area, when they have an appointment available, and that person is also eligible given the current priority groups that are at that point in time. And so that is what it's meant to be. It's a website where somebody can register, and then they don't have to keep coming back to check every day. They'll simply wait until that provider reaches out to schedule them.
Great, thank you. And sorry you had to repeat all of that, but a quick follow-up I have is a lot of the questions and calls we've been getting are from older people over the ages of 65, you know, even 80 years old, who are really concerned that they don't have a computer or internet access to even access a sort of system like this. So what advice do you have to those people who really want a vaccine, need a vaccine, but just don't have the resource to get it?
Yeah, in that case, we do have a solution, which is if they call their local public health district, each of those health districts have a specific number, they can actually have the local public health district call centers will be able to enter the information for them. And so if they don't have access to a computer or they don't have access to the internet, they can simply just call their public health district and they can provide that information over the phone and we'll get them into the system.
Great, thank you.
Okay, next up is Kyle Fahnensteel.
Thanks. This is Kyle with the Post Register. Dr. Hahn, I think this question is for you. You mentioned that Latinos aren't well represented in current priority groups. I'm wondering how many Latinos in Idaho are currently eligible to receive the vaccine?
Yeah, Kyle, and I'm sorry, I saw you asked us that question this morning, and I have not had the time to get that number for you. But I think as we, you know, as I mentioned earlier, the estimate I was able to get this morning is that 5% of our folks 65 and older are of Hispanic descent, and 5% of our healthcare workers in Idaho. So I haven't had time to do all the math yet, but I think what we will see is that, but we can send that to you afterwards. And I apologize, I did see that question. We will also, we're very hopeful as we open this up now to working age populations, we will see a lot more and proportionally a lot more folks of Hispanic ethnicity qualify as essential workers.
Thank you. And I also wanted to ask, in moving up Group 2.3 to start next Monday, what does this do to the rest of the vaccine timeline for priority groups in Idaho?
I think it's Monday, March 15th, Kyle, just to be clear. Yes, I'm looking at my calendar. So it is not till the 15th. And I'm sorry, because that startled me. Could you repeat the question?
So, sorry, I had my dates mixed up.
Right.
What does this do to the rest of the vaccine timeline in Idaho?
Yeah, so actually, we aren't sure. As you know, we don't want to predict too closely and then have people disappointed. But it is likely that around April 1st, we will be able to move into a Group 3 if Group 2.3 goes as expected. But we have to kind of wait and see. But I think that our feeling right now is that we're still on track for an April 1 broadening as is currently mentioned on our website. And again, Director, please, if you had, we've had a lot of discussions about this, but that's my feeling and my understanding.
Yeah, no, I would just confirm that. I think we are seeing a bigger flow of vaccine. As I mentioned, we have 40,000 first doses coming in the state now. As you just heard from Sarah Leeds, there's an additional 13,300 doses of Johnson & Johnson or Janssen's vaccine coming in this week. You know, that pushes us over 50,000 first doses a week. We should just mention while we're here that the Janssen vaccine or Johnson & Johnson vaccine is shipping everything they have this week. And so we actually expect 0 doses from them the next week, and then they'll get onto a production schedule after that. But the net is we're just seeing, you know, we expect to be over 50,000 doses a week in the state, and probably closer to 55,000 doses a week, first doses. And that has allowed us to accelerate the timelines. And we expect that to affect positively getting to Group 3, as Dr. Hahn mentioned, meaning we would likely get to Group 3 somewhere around the 1st of April.
Okay, next question is Nicole Foy.
Hi, Nicole Foy from the Idaho Statesman. So I have a question about this rollout to specifically thinking about large-scale farm operations and food processing workers. I know that Central District Health was issuing guidance either earlier this week or last week, telling these businesses to start talking about setting up clinics and working on that. And so I'm curious that there's a lot of options. Some the Central District Health said, you can go to a local clinic, or you may have a work-based clinic. How is that all going to work out between allowing employees to either go to their local hospital and get the vaccine, or waiting for their employer? How is that going to be determined?
Yeah, hey, thank you for that question, and very cute cat there. Yeah, so it is, this is a brave new world for us. Really up until now, it's been very clear that our healthcare providers, hospital settings, clinic settings has been the place for most of these vaccines, or for, of course, long-term care residents at their long-term care facility. There's no question about moving people to get that vaccine done. However, most people feel that in many cases for employer-based vaccinations, you're going to have the best success and the best uptake by bringing the vaccine to that site. Not only then do you have the opportunity for people to miss the least amount of work possible, you don't have transport issues, etc. So really, in a way, that is the option that we prefer and hope that in many cases are made possible. That said, we know that in order to be expedient, the local health departments and some of our folks that can go and do mobile clinics are limited. So some employers are probably going to have to work with their employees to come on into some of the sites that have been doing, for example, where St. Luke's and St. Al's and Primary Health and so forth, and get their employees into those sites. So it's going to be a mixture, and I think we're going to see as we go how well various options work out. But I think that in general, we've seen this year after year with, everything from flu shots to other outbreak response vaccination efforts that we've done, is that the best thing we can do is bring the vaccine to the people where possible. That said, we know each health district has been working with their large employers and with their smaller employers to come up with a plan, and it will look different in every health district. And I don't know if, Sarah, you have more detail to add to that, or want to add anything.
Dr. Hahn, I think you've summarized it great.
I just have a quick follow-up then. So what's, for the, employees at these food processing plants who are agriculture workers, what's going to be the best way for them to find out where they should get the vaccine after they become eligible?
Yeah, I think in most cases, the health districts are working through the employer. So for the employee, they're getting messages from, I know every year we hear through our email that, hey, they're doing flu shot clinics, down at the whatever next week, sign up here. And I think for many, especially large employers, they have those types of systems already in place for employee health, employee wellness. And that's going to be the best place for most employees to learn about how to go. Because we understand that's one reason why I think the director felt strong about giving this 2 weeks notice, so that employers can start to gear up and get those messages ready and make sure that the employees aren't caught off guard and don't know where to go.
Okay, next up is Trevor Fay.
Hey, good afternoon, everyone. Can you guys hear me?
Yep.
Hey, so my name is Trevor. I'm a reporter over at CBS2, and I was just curious. I had heard transparency cited in the past for the reason why race and ethnicity needs to be recorded or is recorded when it comes to these vaccines. But is there a broader reason why this is necessary or even important or relevant to know someone's race or ethnicity when it comes to the vaccines?
Yeah, well, I'll take a stab at answering that, Trevor. I think what's well recognized is that, I think of the old saying, what gets measured gets done. We could end up at the end of the day and say, hey, we got 90% of our Idahoans got vaccinated. Isn't that great? And we miss the fact that in certain populations, it's much lower. Why that really matters from a public health standpoint, not only is obviously does it affect individual health, but then communities where they're under-vaccinated can be sources of outbreaks, right? If there's a population or people that living together and they didn't all get vaccinated or have a high level. So from a public health standpoint, we worry a lot about pockets or areas where there's lower vaccine rates. That's why we're not just looking at, we've focused on race and ethnicity because of the announcement today, but the equity plan I was talking about, we're really looking at everything from county by county. If you go on our site right now, you'll see there are some counties where they're doing a lot better with vaccination rates than other counties. And we are starting to laser focus on that and really try to figure out how can we support those counties to up their vaccination rates. We're looking at age-based, which for the moment is kind of funny, right? Because we've been prioritizing elderly. So but as we go to the general population, are we seeing the younger folks saying, I don't need that vaccine? So equity is going to be a lot more than just race and ethnicity. It's really about trying to make sure we don't have pockets of unimmunized people who not only for their own health are at high risk, but are also potentially going to be causing or spreading the disease amongst themselves and then eventually to the whole population.
Kind of like what you guys were saying about the Hispanic population, making sure that nobody is underrepresented in receiving the vaccine.
Exactly. Yeah. So we really have a lot of work to do, and I think that we've talked about Hispanic, we talk about age and geography. We have our refugee population, making sure we're getting good information to them in the appropriate languages, that kind of thing. So it's really going to be we have to be very thoughtful about looking at all our populations that might not be aware of the vaccine and might not know how to get it.
Got you. Thank you.
Mm-hmm.
Okay, next we have a question in the chat from Gustavo Sagrero, and his question is in reference to an equitable distribution of vaccines. He writes, what kind of options have already been deemed unviable from health and welfare's perspective, but can likely be implemented from other organizations?
Interesting. I can't, I'm gonna let Sarah and the director weigh in. I'll speak up first and say I don't think we've said anything's not possible or outside of our ability, other than just the amount of staff we have. Not only, and by we, I mostly mean the local health districts who are doing a lot of the vaccinating. We support mobile clinics, we support large vaccination sites, small private providers, pharmacies, on-site vaccination at long-term care facilities, et cetera. However, we definitely can use help from other organizations. And I would say particularly, we've just been talking about equity, groups like the Hispanic Commission or groups that serve such as AARP and others that are focused on the elderly can help us reach out to those populations and really educate and encourage them and figure out how to make sure they're getting equal access. And with that, Director Sarah, I don't know if you have more to add that I may not be thinking of.
Dr. Hahn, I would just add that, and this is a team-wide sport, a team-wide effort across the state, and it really is. Our role is really to drive the prioritization process and determine allocation across the state. But the actual work of vaccinating, there are no doses being administered by the Department of Health and Welfare. Those are all done by the 400 plus provider groups, most of them private provider groups that take care of that vaccination process. And so I would say we're already in a pretty strong public-private partnership to really make sure we get to every corner of the state, and would welcome input and help from more of those individuals and organizations that are interested in helping to get vaccine out, particularly to those populations where it may be tougher for the reasons we talked about earlier to get them vaccinated.
Okay, next.
Oh, Sarah,
sorry, Sarah, if you wanted to.
Yeah, no, I was just going to say, I don't have anything to add. I think Dr. Hahn and Director Jeppesen gave great answers.
Okay, next we have Joe Paris.
Real quickly, I have two questions. My first, back to that registration tool. When can Idahoans expect to have that roll out? What will it be called? And is this involved with PrepMod at all, or is this an entirely new tool?
Dr. Hahn, you want me to take that one?
Yes, I assumed you would, Director.
Great. Joe, thank you. We anticipate that happening late this week. When we will issue, either us or the governor's office will issue a press release, and that will be available via a link on our website when we'll also publish the URL, the website for where people can go to register. And so the timing is probably late this week, and so watch for that later on. And then the question, Joe, you raised was whether this is PrepMod or something else. We actually determined that for this purpose, PrepMod was not going to get us what we needed. And so this is actually a solution that we've put together here internally with one of our vendors. That's really just a web-based solution that captures the information of people who are interested to get vaccinated and allows us to get that information to our provider partners. The PrepMod solution worked great for gathering the information from the public, but was proving to be challenging and connecting up with our provider partners on the back end to get them the names. And that's why we went with a different vendor to get a solution that would work here.
Awesome, thank you. And then my other question, back to the new dashboard data that was put out. It's understandably that it's not an entirely full picture, the demographics of who's getting the vaccine, with the option people have of not having to report their ethnicity or race. From the preliminary data, though, it does look like there could be a disparity. And as you all touched on, as we go on, if it does appear that some communities like the Hispanic or Latino communities are not getting an equitable share of vaccines, what type of strategies are available from the Department of Health and Welfare standpoint to do something about it, or is it out of their hands?
Yeah, I'll start. I think that we feel very much this is part of our responsibility. We know the public health districts take this very seriously and are already working with the Hispanic Commission on working on having language appropriate settings on education, even working with the church and making sure education is getting out through churches that have Hispanic populations. So that work is already underway to try to make sure education is there. And I think one role that the department can really play is to, number one, by collecting and publishing and sharing that data so that people are aware where the disparities are. We can also provide encouragement, for example, for using mobile clinics for trying to help support. We are getting funding to help support things like mass clinics or clinics that can get out to where people live and get into their communities. And I think as we move forward, that's going to become more and more important part of our strategy and our role. And Sarah, I don't know if you have anything to add about that you can.
Yeah, no, I think just that the immunization program is always welcoming partners to help us get to just underserved populations and populations that are maybe a little less our traditional audience, hard to reach groups of people, and that requires new partnerships and expanding, what we're looking at. So we're doing that now.
Great, thank you so much.
Okay, next we have Rachel Cohen.
Hi, Rachel from Boise State Public Radio. I have two questions about the race and ethnicity data. One was that I know the capability to record this data was only added to IRIS a few weeks ago. So I was wondering if the data that was posted to the website yesterday, if the department is able to capture any race or ethnicity data from before that point, or if the data posted is just after that capability was added to IRIS.
That's a great question, Rachel. Sarah, do you know if we were able to go retrospectively and pull that additional data in from older immunization records?
Yeah, I was going to pull up an email really quickly to see. I think we're doing that with COVID doses, looking retrospectively. If I can pull up the email, I can look at the totals and tell you for sure.
Okay, and Rachel, if we can't get an answer for you on this call, we'll make sure we get one afterwards. I remember having that question in my head a week or two ago, and then I forgot to follow up on it, so I'm not sure, but I think we're all interested in doing that. Of course, we want the best data we can for the entire immunization effort.
Yeah.
Okay, thank you. And my second question was, Dr. Hahn, you mentioned that the department is trying to improve the data collection specifically for race and ethnicity, and I was just wondering what would go into that, or what does that look like to try to improve that collection?
Yeah, sure. Sarah and I talked about it this morning, and she said she'd be happy to talk about the specific efforts of the program to try to keep an eye on how we can improve. Sarah, do you?
Sure. Yeah. So there, it's a multi-pronged effort. And a lot of it is educating providers. As you know, COVID providers are required to report on race and ethnicity. Now, that does not mean that an individual has to report their own race and ethnicity, but it would go in as unknown. And so what we're trying to do is ensure that every provider knows that they are required to report that, and we're checking to ensure that providers are reporting that. Next week, every week we conduct education opportunities with our Idaho COVID vaccinators. And so this week we're training them on that registration tool. Next week we'll be training them on just avoiding common data entry errors for IRIS, our Idaho's immunization registry, and collecting race and ethnicity will be a piece of that. We're putting out a document for that as well for providers so that they know, they have something in writing for it. We are reaching out and working with PrepMod because some providers, some vaccinators are using PrepMod to organize and schedule their clinics. And we need to ensure that PrepMod is collecting that. And that is a work in progress right now. And that should happen this week, that PrepMod will start collecting that data for the providers that are using that. And then that will start being entered into IRIS as well.
Thank you.
And those are just our immediate efforts. This will be an ongoing work in progress as we look to improve the quality of that data.
Okay, next question is Audrey Dutton.
Good afternoon. This is Audrey Dutton from the Idaho Statesman. I am curious. I've heard from a lot of people who are worried about their older high-risk loved ones not getting a vaccine as more people become eligible, since we do still have a lower supply than demand. We've seen obviously that mobile and motivated people are getting it, but what is the last mile solution to get the vaccine to people who are homebound, lack reliable transportation, don't have family helping them make appointments, things like that? What is the state doing to help, or what can the state do to help public health districts and vaccinators? One idea I've heard is, why not have home health providers become vaccinators and go out and to those folks, find them and go out to them? Can you speak to that at all, Sarah or Dr. Hahn?
Yeah, I'll start and I'll let Sarah and the director may have some thoughts as well. But you're absolutely right, Audrey. We recognize that across all levels, the more mobile, oftentimes the younger, the healthier, are going to be able to get themselves, first of all, know how to use the internet and get themselves signed up, and also are going to be able to get to places. And it's going to be harder and harder as we go, trying to reach populations that can't get out. There already are some innovative programs around the state that we support, including using EMS providers. They're using home health, but I think the best thing we can do at the state level is, number one, we can offer some assistance. You know that we have, of course, National Guard working with the local public health districts. We also have a lot of assistance now that we haven't talked about yet, but you all saw the announcement earlier this week that FEMA is assisting us now with funding to really improve vaccination. So we can help fund and support local plans to get into, and now with the Janssen vaccine, as I mentioned earlier, we have the opportunity potentially, it doesn't have to be the Janssen vaccine in any case, but it makes it easier to do some of these small mobile one-by-one, going home to home, doing immunization clinics. So I think the best role at the state is to help fund and support and provide folks like National Guard assistance. And Sarah and Director, I don't know if you have more thoughts what we can do.
Yeah, I think Dr. Hahn, or Director, did you want to go first?
You can go right ahead, Sarah.
Okay. As we are in week 12, I think, of this vaccine rollout, and when you think about the scale of what we're doing as a country and globally, we're really in just the baby steps of what we're doing. And as we get more and more doses into the state, we can really start being a little more creative. And I think we're at that phase where we're about, looking to we're out of those more rigid populations where we know where those people are. We know, we knew where the healthcare providers were, and we're needing to look to getting, instead of people to care to people, and with this FEMA funding will really help us expand how we work with partners. And if a group can use FEMA funding to buy a mobile clinic, then we can really work with them and get them out on the road with vaccinating people who need and want the vaccine.
And I was just going to say, I don't have anything to add to that, so thank you.
One real quick follow-up. The concern about people 65 and up not getting the vaccine while it's being offered to more and more people, especially when the 16 to 64-year-old group opens up and it's kind of open to everyone. What can you say to kind of help people who are really worried about that, either get their loved ones in, get them an appointment, or what are there any guarantees that you can offer?
Yeah, Audrey, I'll start. First of all, I want to just tell you, I think it's unlikely that our advisory committee, they're an independent body, but I think it's unlikely they will open it up, for example, to 16 to 64 right away. I think you probably know that, but that it'll probably be a more gradual opening up. So for example, people 50 and older with an underlying health condition, or adults 60 and older, or those kinds of, it'll be a more measured opening up. So we hope to avoid having just a huge crush of people, and that just makes that many more frustrated people who may eventually give up. And we don't want people to give up. We want people to know that when we say they're eligible, that they will get a vaccine shortly after that. Now, that said, we don't know for sure what that's going to look like. And one thing that I know at least a few of the health districts have already started to do is, as they've started to see a little bit more slowing down with their immunization clinics, like they have some that they're just taking longer to fill up. Instead of filling up within an hour of opening some slots, it's taking a few days to get that vaccine clinic scheduled. They're starting to put out press releases, and the way we think of it is, there are people out there that probably tried a few weeks ago and they got tired of being put on hold, or tired of refreshing a website and not getting anywhere, and they've kind of given up. And trying to get some word out to those folks and say, hey, it's easier now, come back, try again, before we open it up. And that's one thing we're hoping will happen a lot in these next 2 weeks, when that seniors are reminded that this is a good time, that things are slowing down a little. They should be able to get an appointment now, and yet in a few weeks it might get a little harder again. I don't know if Sarah or the director, you have more to add about that.
I would just echo what you said, Dr. Hahn, which is that's one of the reasons we're giving kind of a 2-week heads up notice that we're moving to the next group, and potentially even a month from now moving to the larger group 3 that we've been discussing, is so that those either 65 and older who haven't got a vaccine, or those that are caregivers and family members that know that their loved one hasn't gotten vaccinated and know that they want to go ahead, and it's now's the time to make that effort, especially if they've been frustrated before and kind of given up, as you mentioned. That's also the reason we're going to launch this registration tool later this week, is to try to make that as easy as possible over the next couple of weeks for those that are still wanting to get vaccinated to raise their hand, so that we can make sure we get them in as quickly as possible. So I would say to those caregivers and family members, look for appointments now, and look for this tool coming out later this week, and get your loved one registered so we can get them vaccinated before we move to these other groups. I should also mention that those individuals will still be eligible to be vaccinated. Once you're eligible, you're eligible. So they won't lose their chance. But as you said, Audrey, there'll be more people competing for spots in a few weeks. So.
Next, we have another question from Hyatt in the chat. What do you know at this point about the efficacy of Johnson & Johnson, Moderna, and Pfizer vaccines on the COVID variants?
Yeah, that's a great question. Really, in a way, we know the most about, really the best data right now is about the Johnson & Johnson, because those trials occurred a little later, and they included trials in Brazil and in South Africa, where some of these variants are coming from. And that's actually in Johnson & Johnson's favor. is that they didn't perform as well as they did in the United States, but they performed pretty well, even in South Africa and Brazil, which gives confidence that these vaccines are effective. I mentioned even in South Africa, this Johnson & Johnson vaccine, there were no hospitalizations among people who had received that vaccine after they had passed the immunity time period. So they found that once that vaccine immunity kicked in, it worked very well against severe disease, even though at the time in South Africa, over 90% of the cases at that time were the variant. So Pfizer and Moderna, we have less data. There's a great set of slides on the CDC website. They presented on this very topic on Sunday to ACIP, the advisory committee, a great slide set about the variants out there and what is known about the different vaccines for those of you that are interested in the details. But for those two vaccines, we have more lab type data suggesting that there might be a decrease of efficacy of the vaccines. And nonetheless, most people believe it's probably still effective. You might just have a little bit of a drop in effectiveness. So we'll know a lot more over time as these variants become more common.
Next, we'll go back to Chase Biefeld.
My question is probably for Dr. Jeppesen. It's about clarification in group 2.3 with homeless shelter residents. I was wondering if this was just residents of people living in a shelter, or I was just wanted more clarification there as to the homeless population.
I'm actually going to defer to Dr. Hahn or Sarah on that.
Yeah, I can start with that. I actually have been working pretty closely with some of the providers and the physicians that are caring for those homeless residents. And what I would say is that the recommendation as it's currently written is really geared towards people residing in shelter settings. But many folks that maybe, for example, prefer to sleep outside or in other settings may come to a shelter regularly for meals or other services. And I think as we start to vaccinate those populations, because it's such a fluid group, I think they will all be included in those vaccination efforts because they have such close interactions on a daily basis. So if that's kind of the question, like would they be left out of a vaccination effort? Just knowing the planning that's going on now, I would say no, that they'll be included because many of them participate and interact with other shelter residents.
I mean, just a quick follow-up there. On the AARP town hall meeting earlier with the governor, there was a caller that was just extremely upset. She said she's a caretaker, and she's just, and from her view, she was very baffled by that, and she thinks that all homeless people in our state are going to get a vaccine before her when she's just very frustrated. It sounded like, I don't know. I just think, I guess my question is, there will not be enough for, I know there's data lacking, but there won't be enough at once to give it to all the homeless people in the state, right? That's my question.
Yeah, that's a difficult question. I think that, as the director alluded to, we're all excited this week. So we got a big bump. We got all these Janssen vaccines coming in, but next week that's gone. It's a bump out. And then we're kind of holding our breath, waiting to see whether we'll continue to receive Janssen. I mean, they say that more is coming, but we have not seen any numbers. And so it's very, very hard to predict how much vaccine we have. But yes, for the time being, I know there will always be some people that feel that, they're frustrated that they have not yet been able to access the vaccine. So the best I can say is that, believe me, we would all love to have more vaccine and to get everybody vaccinated, this week if we could. And I don't know if Sarah or Director, you want to say any more about that?
Yeah, I would just echo what you said, Dr. Hahn. These are tough decisions where we're following the ACIP advisory committee guidance. These are tough discussions that the coronavirus vaccine advisory committee is making. We would love to have enough vaccine to vaccinate everybody in the next week. That's just not the situation we're in. And so we follow that ACIP guidance, and we also follow the recommendations of the Coronavirus Vaccine Advisory Committee as they make those very tough decisions. I will say that our best estimate of the homeless population in Idaho is somewhere around 4,600. Obviously, we don't know for sure what that is. It's a little bit difficult to keep track of the homeless population, but that's roughly the number that we think is out there that are homeless. And so obviously CVAC will on Friday have another very important conversation about how we move into group 3, and we'll see how that plays out.
Great. And I just want to quick mention, I dropped in the chat the that presentation from CDC I mentioned about the variants and how it impacts how vaccines and variants, what we know right now. So please take a look at that. It's a very important topic, and there's some great information in there.
Next, we have Nicole Foy.
Nicole Foy from the Idaho Statesman again. I just want to return briefly to something I know you've already answered a lot of questions on, so I appreciate it, about equity. And I am wondering if there is any concern about the ability to effectively implement an equity plan if it's just being developed now, especially considering some of these populations that are likely going to be targeted and making sure they're being reached equitably. For example, the Hispanic population, we've known since May that they have, Hispanic people in Idaho have been disproportionately impacted by COVID. So I'm interested in if the time crunch, if there's concern about getting this implemented effectively when we're at couple 100,000 people who have already received vaccines.
Yeah, I'll start with that. First of all, I want to emphasize, as I think we've mentioned before, it's the local public health districts that really know how to solve this problem. We think it's important to have a statewide plan because we think we can help, like we talked about earlier. There are ways we can help. We can provide money, we can help make sure they have the staff, but the health districts have not, even though we as a state are just kind of getting our heads around what can we do to really ensure it. The health districts do have plans that they're moving into. I heard some really encouraging news from Health District 3. I think they're very excited about the Janssen vaccine, particularly using it to now get out into some communities that they've had, that don't have the freezer capacity and they haven't been able to get to as much as they want. That said, you're absolutely right. I think back in May, March, April, May, we were being told there'd be a vaccine maybe if we're really super lucky in a year. And of course we started thinking about it, but this just got super accelerated, really with the news in the fall that vaccines were pending. Yes, absolutely. We wish we'd had more time and we were further ahead of the game. We acknowledge that we should, it would have been really nice to have had a state plan out 2-3 months ago. But that said, we need to what we can. I don't think it's too late. Again, we've been focusing on healthcare workers, long-term care. We've had these populations that needed to be done regardless. Now's the time, and I think we're poised that we can make a difference at this point. And Director and Sarah, I don't know if you have anything to add. I know we're running out of time, but
I would just add that, yeah, I think Dr. Hahn is correct that it would be great had we had a plan, several months ago. But even if we did, we would still, I think we would still be honing that plan because equity work until we achieve equity, it's never done. So we need to keep working on it. It will be something that we continue to focus on, for quite a long time until we achieve equity. And so, I think we are where we are, and we'll continue. We have a focus on it, and we'll continue to have that focus on it.
Okay, and just one last question for today from Kyle Fahnensteel.
I wanted to ask, the Biden administration announced today that it expects to have enough coronavirus vaccines to let everybody who wants one get one by the end of May. I'm wondering how Idaho is interpreting that and how that affects our plans.
Yeah, thank you, Kyle. This is yes, you miss a half day of news and you miss a lot. I just saw this morning, which is great news, that Merck is going to actually help produce the Pfizer vaccine, or excuse me, they're producing the Johnson & Johnson vaccine, and Sanofi is helping with the Pfizer vaccine. So the companies are all really, I think, with federal assistance, they're working together. And I think our production expectations are going up because of that. Merck was developing their own vaccine, and if they were still doing that, I doubt they would be producing a competitor's vaccine. So the news keeps changing. We are going to do our best to keep, as the director alluded to, we've got over 400 enrolled providers. We're going to keep enrolling providers. We're going to keep, using the federal resources that we're getting, the funding, to try to get not only as more vaccine comes in, we need more vaccinators. And of course, we need to make sure that the population wants to get vaccinated. So we need to keep focusing on education and equity work to make sure that people do have access to that vaccine.
And I would just say that I think our providers are well positioned. Our biggest bottleneck has been supply. And as you can see, supply has gone up quite a bit since December 15th, actually. But we keep asking the providers, could you double or triple or quadruple your volume? And many of them say yes. And there's many that haven't even gotten the vaccine yet because we've been so limited supply. So I actually think Idaho is very well positioned that if our federal partners and the manufacturers can get more doses to Idaho, which is really what would drive that item, then we are, I think, extremely well positioned to get those doses out to the public and get them to people who want to get vaccinated. So I would say that's great news. Is if production is actually going to go up, I think we're well prepared to take advantage of it.
Okay, we are out of time for today, but we are planning another media briefing about COVID-19 vaccine at 2:30 p.m. Mountain Time, Tuesday, March 9th. Watch for those details on Monday. And thanks everyone for joining us today.
Thank you.